This is LiveWell Talk on supporting during a neonatology intensive care unit stay. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Parents and families who have a baby that are in the neonatology intensive care unit, or the NICU, they're under tremendous stress, emotional, financial, information asymmetry. People are talking in terms they don't understand. They want to be with their newborn that's ill 24/7, but they still have lives and jobs, and I can't even begin to imagine the stress that they're under. But medicine's a team sport, and today with me is Karla Pisarik. She's the family support liaison with UnityPoint Health for St. Luke's Hospital at Women's and Children's Health Center. Karla, give us a glimpse of just what goes into your day as you help support these families that have these very vulnerable, ill children that are in the NICU, or the neonatology intensive care unit, and how you approach that.
Sure. So when we have families that come into the NICU, it is essentially it's a roller coaster. It sounds very cliche to say that, but every day is a little bit different, and in some cases every hour can be really different. And when they first come to the NICU, like you said, it's a whole new terminology. I'm not an auto mechanic. I wouldn't know how to fix a car.
That's a great
So
analogy.
it's kind of that same idea that we use so many medical terminology, and when you're in a medical facility, and so learning those terms and even just grasping the idea that your child is in the NICU. I often will share with families, you didn't plan on being in the NICU. Even sometimes when we have high-risk pregnancies where they're being followed, it's not a guarantee that they're going to be in the NICU, but healthy babies sometimes need a little extra support, and they come to the NICU. So it's not always the teeny tiny babies that a lot of folks might think of when you think of someone being in the NICU, but it can be a term baby just the same. So I help them and kind of cope with that experience. So the medical staff take care of the baby, and I'm one of the team members that help the family members.
I think people forget, I don't forget, because I think what they do over in the NICU is just amazing, really truly is miracles. Mm-hmm. But those they may be measured in ounces, but they have the same number of internal organs that an adult has.
Right.
And all these organs are affected, and like when I take care of people in the intensive care unit, they may have one or two organ systems that are compromised. But really, truly, a lot of these babies, it's their whole body that's compromised,
yes.
Because they're born prematurely sometimes. And as I said earlier, medicine's a team sport.
Yep.
And I think physicians are part of that team. They're not the only member. Sometimes physicians forget that, and they have to be reminded, but that's okay. What are the most common, let's start with the most common concerns that family members have. I can think of the obvious, you're missing work, family medical leave, etc.
Yes.
What are the most common?
You kind of nailed those. Missing work. Well, first and foremost, probably, is my baby going to live?
Right.
That is the first worry. And so reassuring them that we're going to do, obviously, everything we can. And so that, their child being sick, work, other kids. We have a fair number of families that are transferred into St. Luke's, so they don't necessarily live in or even in close proximity to Cedar Rapids. They might come from Findlay or Waterloo or even beyond that. And so we have some families that might be 2 or 3 hours away, so transportation is a big issue. So when you combine all of those kinds of things, sometimes we might have little support from other family members, or they might not have a lot of support from friends. So those, I'd say, are the kind of the top ones. Kind of just wondering how they're going to get through this experience of being in the NICU, especially when you add the sick child and then everything else to that.
Yeah, and you described that roller coaster, that clinical roller coaster, which is so true. And even as physicians, we see the patient on Monday morning and we make changes, and we expect those changes to have benefited the patient when we come in Tuesday and see the patient again. And sometimes it takes 48 hours, 72 hours to really see a change in your treatment plan. but we're kind of on this daily schedule with daily rounds that we do that. Now, I know, being a little inside baseball here, but I know you have structured meetings with the family. You want to tell us about that?
Sure.
I think that would be important.
Yeah. I am fortunate. I have the opportunity to work with families a little bit differently than maybe the medical staff does. And I have opportunities for them to do some activities. So I wouldn't necessarily call them support groups because we don't really call them support groups, but just opportunities to meet other families. So although our NICU is single rooms, which is wonderful for privacy, for the baby's development, they might not meet somebody that might be right next door to them or right next door to their baby. So I offer some opportunities where they can take a break from being that parent in the NICU. And we might do some milestone activities with footprints. This morning, actually, I did that with a family. And use the baby's footprints to make a small craft that later on, 5, 6 months, 5 years down the road, they can look back and see that. Scrapbooking is really big in our NICU, and that's a great way to, again, kind of see those milestones day to day, or in some cases we have families that are month to month and can be there for a very long time. And then when they can look back at those pictures and see maybe how small or how sick their baby was, and then a few years down the road that, they made it through that. We're also able to offer massages for our parents, which is phenomenal because they sometimes don't even realize how stressed they are, or maybe, if you're dealing with everything in that's been going on, it's important for you to take care of yourself, or it's important for our families to take care of themselves. So we really try to, tell our families to, just as much as we are taking care of the baby, it's important for you to be, mentally health aware and taking those breaks. And whether it's even walking around St. Luke's campus for a short walk just to get out of the NICU, because there's some long days.
Yeah, I always give that pep talk or that pre-talk to families in the intensive care unit, the adult intensive care unit, to say, look, they need us right now, and you got to save your reserves. If you're here 24/7, I know you love your loved one, and you want the best for them, and you want to advocate for them, because that's important.
Right.
That patients have an advocate that's not in the medical field, someone that's just conveying that. But if you wear yourself out now, then 10 days from now when they go home, you're going to be not helping finish the treatment plan.
Right.
And certainly that's important. One of the better kept secrets, and it's not intended to be kept a secret, is the Ronald McDonald room.
Yes.
And so I think to give a little explanation what the little history behind it, and I believe it's the only room in the state of Iowa. There's Ronald McDonald houses, but I think this is the only one that's a room.
Well, just more recently, there is, I believe, a couple of other rooms.
Okay, all right.
But we were the first.
Okay,
Yep,
right,
we were
good.
the first in the state. Yep. So the Ronald McDonald room it's near and dear to my heart as well. I've used that with my own son. And but the Ronald McDonald room here at St. Luke's was a partnership, or is a partnership, with Ronald McDonald Charities, and our families are able to use the room, the kitchen, the living space 24 hours a day. We have food in there. The kitchen itself, I guess, is open from 8 a.m. to 8 p.m., but there's food that's available. And as much as someone would think that food is not maybe an important part of a medical stay, it really is for the families, because that's something normal. We all, breakfast, dinner, lunch, it's important for us. Again, talking about taking care of yourself.
And there's emotional comfort there.
Absolutely. They provide meals. It's another opportunity for those families to meet one another in the family room. And sometimes it might be a quick 5-minute, I'm going to grab a cookie that they made in the afternoon, but they can connect with another family that would be going through a similar experience. There's a TV in their kind of living room space. There is a meal, the 5 o'clock meal, or the dinner time meal, is usually made by some community group, which is phenomenal that we are able to bring in groups from not only Cedar Rapids again, but throughout the area. Or we have families that have used the Ronald McDonald room, and they come back and will make meals for, because they've experienced that and they know how important it was. We also have we have 3 sleep rooms. So those are open 24 hours a day, and that's an opportunity for families. It's almost like a hotel room. They have a comfortable bed. They can, be still on the floor at the NICU, but just down the hallway and get a good night's rest.
Are there mixed shakes available on St. Patrick's Day, the green ones?
There hasn't been, but that's been brought up before.
All right, that's something we really should prioritize.
Yeah, we'll look into that.
Up the list, definitely. Let's say I'm a family member and my child or grandchild is in the NICU. How do I advocate? I mean, what is the trigger to say I'm not connecting with the physicians, I'm not understanding in this? How does someone go about getting that support from you? I know you're proactive. You're like, you hold the title of one of the kindest, nicest people that I've ever met. I mean, that an unchallengeable title. But how does family do that? And before we get to that, back to the Ronald McDonald room, how can support groups volunteer for their support group to come do that? It's a great activity. I know, we've been involved in that, and I know some other service organizations. But how does that happen?
They would just need to contact our family room coordinator, or they can go online, and we have a link that's connected with the Ronald McDonald Charities, and I believe that they can even sign up online as well. So it's fairly simple. Even we've had people that'll call up to the NICU, and we can even transfer them over. So they have a calendar, they set everything up, make it very easy, kind of go through guidelines. So it's great. Yeah, families do it. We've had sports teams that have done it. It's a great volunteer opportunity and great way to give back. Yeah,
absolutely. Now back to that question about I'm a family member. I just don't feel like I'm being heard, or I have questions. Not everybody's. I mean, there are people that are willing to stop the line and say, I'm not understanding this, explain this. As a physician, a lot of times you're meeting with a family and they're just nodding their head yes, and you're wondering, okay, how much are they understanding this, or are they just being polite?
Right.
And we use the teach back method to say, okay, you tell me what I just told you.
Yep.
And sometimes it's like, well, I didn't get the job done here. I need to talk, connect with them more than what I have done. How do they speak up in the NICU?
Yep. We each family, or each in our NICU, we have 4 different pods, we call them, and each of those pods have a day that we have a family rounds. And so, although that's not the only time that they can talk to everyone in the team, that's always available. But it's a cohesive time where everybody talks at that family rounds. So that's one great opportunity to go, because I'm there, our social worker's there, our physicians are there, the bedside nurse is there, dietitian. So there's a number of the multidisciplinary team that's there. So that's a great time. Then following that, there's those opportunities where each of us might go in individually, or when I, check in with the families and see how things are going, and, that might come up then. Or can you explain this to me? We really try to advocate. I think the whole team does a really nice job of that, of telling our families, if you don't understand it, it's okay if you have to ask 10 times. We know, there's a lot going on. So we've, as a team, have been through this, but this family, this might, obviously be their first experience. So advocating for them to really speak up, even though sometimes that might be hard. But then it's in those one-on-one conversations as well that those come out where, I might not understand, or they might say something, and I might say, let me have the doctor come back in and talk to you. I think that might be a little different than what's, happening, or what the plan is. And we also have care conferences, which for our babies that are there maybe a lot longer time than some, we kind of had those touch bases with the whole team again. And this is the plan for the next maybe 2 or 3 weeks. And then, especially in that transition home, just as overwhelming as it is in that beginning stage of the parents being in the NICU or the families in the NICU, that going home is suddenly, all the people that were there to help might not be there to help. And so this is what we can do in that transition to make it as easy.
Those patients that are hospitalized for a long period of time, and I've often given the advice, they start to lose control, and so then small things become a big deal.
Yeah.
I've had to referee between physicians and nurses and families disputes over the remote control. Really.
Yeah.
And
Yeah.
this isn't about the remote control. It's the fact they've been here 21 days.
Right.
Okay, and they've lost control of everything that they had before. And you have to realize that. I always used to tell the hospitalist team when I ran that program that, to the world, you're just one person. But to this one person, you're the entire world. And don't forget that.
Yeah. Yeah.
I found when I depart a patient's room, I ask 2 questions. Say, is there anything that you need that you don't have while you're here in the hospital? And do you have any questions that aren't being answered? And it's amazing how often such basic pedantic things that they say, pedestrian things that they say, I haven't had this or that, and it's not that the healthcare team's neglecting, it's just sometimes we take for granted.
Yep.
And if you don't speak up, we can't read your mind.
Well, and there's things that in the overwhelmingness of the NICU that staff have maybe said, and we feel like, it might be documented that we've said it, so we think that family member has heard it. But with everything coming at them, that was one thing, and that they heard it, but that was not, maybe priority. They heard something, different, or heard another piece of that child's care and what was, maybe important to them. So it's following up on a lot of that. And just as we talked before too, they might be worrying about, we might meet with them at 1:00, but they might be worrying about that other child that's at school. And they're trying to figure out, I need to make sure I pick up that child at 3 or 3:30. And that's in the back of their mind. And so they're hearing things and they're listening, but they've got all these other things. I need to pay that electric bill, or I need to go home and I've got 10 loads of laundry I need to do, or whatever, which we do have a laundry facility too, through the family room. But so it's available, but nonetheless, there's lots going on. Even though there's, big priority in the NICU, there's so many things outside of the walls of the hospital that family, or just like you and I, lots going on in everybody's lives.
Right, yeah, everybody's busy.
Yeah.
Busier, it seems like, than they were before.
Yeah.
How did you end up in your position? What's your training? What led you to that? And then how long have you been here?
Sure. Well, I've been here, I'm in my 14th year. Unique way, I guess you could say, that I came to be the family support liaison. My son is a former 23-week preemie, so been through a very similar experience. We were here at St. Luke's for 5 months. He is going to be 15 in December, so it's been a few years since we've been here. But about the same time that we were being discharged, and about within that next year, a few months, the St. Luke's was partnering up with the March of Dimes for a NICU family support program. So the first few years that I was here at St. Luke's, I was under both St. Luke's and March of Dimes. And as my role evolved, I became solely a St. Luke's employee. And so not only am I able to work in the NICU, but in pediatrics as well, which is a nice kind of segue sometimes, because our families are in the NICU for an extended time, or even when it's a week. NICU babies might be a little more at risk of getting sick, so they might go into pediatrics. So it's nice to be able to, make those,
provide that continuity.
that continuity.
Face, absolutely.
So, but by background, I have a degree in social work. So prior to working at St. Luke's, I worked with children and families in the community. So always kind of had that importance.
Now your oldest, she's a senior, right?
Yes.
Will be a senior. Is a senior.
She's senior. Yeah. Yep.
Same age as
yeah,
my
same
oldest.
age as yours.
That's
Yep.
right.
Yep.
Well, this is great information. It's very insightful, and it's always nice to have these conversations with professionals like yourself that are beyond the medical round or medical technology, because there's so much more that goes into that, and medicine truly is a team sport. They might not see that on the television shows or soap operas, but it truly is. And so this was Karla Pisarik, Family Support Liaison for St. Luke's Center for Women's and Children's Health. For more information about women's and children's health in the NICU, unitypoint.org/baby. If you have a topic you'd like to suggest to our Talk On podcast, shoot us an email at stlukecr@unitypoint.org. And we encourage you to tell your family, friends, and neighbors, even strangers, about our podcast. Until next time, be well.